Hello, I am Ruevick Charles Rio, a third-year nursing student of the Pamantasan ng Luzon, Manila. And for today, I will be performing irrigation of colostomy to my patient, Mr. Poo. So, let's start. So, of course, before we proceed to the actual procedure of irrigating the colostomy, we need to prepare the equipment first. So, we prepare the equipment because it promotes efficiency of the nurse while still being able to conserve energy because apparently the nurse would not need to go back and forth just to get equipments that she might have forgotten.
Prior to the actual procedure, it is important to take note of the equipment or prepare the equipment. The equipment that we are going to use would be two pair of non-sterile gloves, IV pole or wall hook, irrigation bag and tubing, irrigation cone, irrigation sleeve, water-soluble lubricant, toilet, warm saline or tap water, towel, two towels and two washcloths, two saver linen savers, mild soap, room deodorizer, bath basin or sink, fresh pouch, and pen.
The next thing that we will do is, of course, to assess the patient. So we assess the patient so that we ensure the safety of the patient so that we wouldn't worry if we ever give a wrong procedure or a procedure that is not meant for a certain patient. Also, we would be able to know whether a certain procedure would be contraindicated to the patient or it can still be done to that specific patient.
Assessment. Assessment should focus on the following: doctor's order for frequency of irrigation and type, and amount of solution, type of colostomy and nature of drainage, client's ability and preference to perform colostomy care, client teaching needs.
Now that we are done with the preparation and the assessment, we proceed to the procedure.
Now let's proceed to the procedure. First is to perform hand hygiene and organize equipment. We perform hand hygiene to reduce microorganism transfer, and we organize equipment to promote efficiency while it saves the nurses energy. Next is to explain the procedure to the client. We explain so that it would reduce the anxiety of the patient and promotes cooperation for the patient. Third is to determine if client is allergic to iodine-based antiseptics and use alternative if indicated. We ask or determine whether the patient is allergic to iodine to avoid allergic reaction that might occur. Fourth is to obtain extra lighting if needed to ensure proper amount of light to perform the procedure. Number 5, provide for warmth and privacy to promote comfort and decrease embarrassment.
Magandang araw po. Ako po si Ruevick Charles Rio. Ako po yung nurse nyo ngayong araw. At ngayong araw po ay ipo-perform ko po sa inyo ang irrigation ng colostomy. So, ang irrigation po ng colostomy ay ginagawa natin para po malinis po natin yung inyong bituka sa paraang paglalagay po ng solution o ng tubig sa inyong bituka para po palambutin yung mga content nito at mga ilang minuto pagkatapos itong mailagay sa inyong bituka ay ilalabas rin po ito. So sa procedure na to makakaramdam po kayo ng mga pagsakit ng tiyan or cramping. So kung kaya naman po ay maaari po kayong huminga at mag-relax lang, pero kung hindi naman po kaya at medyo lumalakas po talaga yung cramping, ay sabihin nyo lang po sa akin para matigil po natin kaagad. Tapos kapag medyo naging okay na, ay pagpatuloy na po natin yung pag-irrigate or yung lalagay ng solution sa inyong bituka. Okay? So, yun po, bago tayo magsimula, tatanong ko lang po, baka meron po kayong mga reaksyon tulad ng pangate or pamamaga kapag kumakain po kayo ng seafood, especially mga seashell, mga ganun po. Ay hindi naman po. Kayo po ba ay nagkakaroon din ng mga ganong klaseng reaction kapag naglalagay kayo ng betadine sa sugat nyo? na hindi naman po. So, kung hindi naman po, ay maigi po yun. Ang susunod naman natin ay kayo po ba ay nilalamig? May, hindi, komportable naman po kayo sa inyong posisyon ngayon. Okay, kung komportable naman po kayo, okay naman po tayo doon. At pansin ko, medyo maliwanag naman po ang paligid. Hindi na po ako magdadagdag ng konti ng additional na lighting. So, ayun, mag-start na po ako, mag-hand wash na po ako. Maglilinis na po ako ng kamay. Ayun po. So, ipe-prepare ko na po yung solution nyo. Babalik din po ako sa agad.
Next, number 6. Prepare irrigation solution and tubing as follows. Obtain irrigation bag in solution. Use 250 to 500 milliliters for initial irrigation. 500 to 1,000 milliliters for subsequent irrigation. Check the temperature of solution. Place in warm water bath if necessary to increase solution temperature. Close the tubing clamp. Fill bag with tap water or ordered solution. Open clamp and expel air from tubing. And lastly, close off clamp.
So, ngayon po ay nilalagyan ko na po ng solution itong irrigation bag natin na ito po yung i-instill natin sa inyong bituka mamaya, sa inyong tiyan po mamaya. So, i-check ko lang po. Tatanggalin ko lang po yung hangin.
After preparing the irrigating solution, don gloves. This prevents contamination of hands and reduces risk of infection transmission. After donning gloves, place the client comfortably in any of the following position. So for my patient, I chose to place the patient on toilet, sitting position. After placing the patient in a comfortable position, gently remove pouch from stomal area. This avoids irritation or injury. Assess site for redness, swelling, tenderness, and excoriation. This determines need for other skincare measures. Gently wash stoma area with warm soapy water to remove secretions. Rinse with clear water and dry thoroughly. This removes soap and prevents irritation of stoma and surrounding skin area. After rinsing with clear water, snap irrigation sleeve to wafer ring. This holds irrigation bag in place to prevent spillage.
Okay, so ngayon po na na-prepare ko na po yung solution na ilalagay natin sa tiyan nyo. Maglalagay na po ako ng gloves tapos po mag-start na po tayo ng procedure. Ayan, so, komportable na po ba kayo sa posisyon nyo ngayon? Or baka gusto nyo po magpalit ng posisyon? So, ako na po kayo sa nakaupo sa inyong bowl. Okay po, so mag-start na po tayo. So, tatanggalin ko na po itong ayan. Ayan, so titignan ko lang po muna yung paligid ng inyong stoma, ng inyong colostomy para makita ko po kung meron man pong hindi normal. Okay. So, mukhang normal naman po. So, pupunasan ko na lang po Okay. Tapos po tayo sa may sabon, i-rinse ko na lang po siya ng towel na may tubig. Ayan po. So maglalagay na po ako ng nalagay ko na po yung irrigation bag nyo ha, na gagamitin nyo po.
After placing the irrigation sleeve, position the irrigation bag with tubing attached 18 inches above stoma. It is approximately shoulder level. Lubricate the cone tip of the tubing with water-soluble gel. This avoids undue pressure on mucosal tissue from rushing of fluid and prevents irritation of stoma tissue.
Okay, so nalagay ko na po yung irrigation sleeve sa inyo. Medyo iaangat ko na lang po itong solution ng 18 inches para po mas maganda po yung pag-flow sa inyong colostomy.
After positioning the irrigation bag, place lower end of sleeve into toilet or large bedpan and unclamp. This provides receptacle for drainage. Expose stoma through upper opening of sleeve. This provides access to stoma for insertion of irrigation tubing. Gently ease lubricated cone into stoma opening to prevent escape of bowel content onto the skin. Release irrigation tubing clamp and allow solution to infuse over 10 to 15 minutes. Slow infusion prevents cramping from overdistension. Make sure to encourage client to take slow, deep breath as solution is infusing because it relaxes client and decreases cramping of bowel. If client complains of cramping, stop infusion for several minutes and then resume infusing slowly. This allows bowel time to adjust to fluid.
Okay, since na-prepare ko na rin po yung solution para sa inyo, so mag-start na po tayo ng infusion ng solution sa inyong chan. So, tanggalin ko na po itong clamp, tapos i-expose ko na po itong inyong stomach. So, lalagyan ko lang po muna ng lubricant yung ipapasok sa inyong stoma para po hindi naman po ito magkasiga. Okay. So, okay na po. Ipapasok ko na po So, mag-start na po ako ng infusion. Hinga lang po kayo ng malalim at mag-relax lang po kayo para po mabawasan po yung pagkirot na mararamdaman nyo. Okay? Dadahan-dahanin ko lang po para hindi niyo po maramdaman yung cramping, hindi po kayo magkaroon ng cramp. Start ko na po. Ayan. Kung ma-feel nyo man po na nagka-cramps, ay sabihin nyo lang po sa akin para po makapili ko na po. Okay? Infusion. Ayan. Infuse po natin to for 10 to 15 minutes. Ayan.
After all the solution has emptied out of bag, clamp and remove tubing.
Ayan, mukhang ubos na po yung laman ng inyong solution bag. So, tatanggalin ko na to isasap ko. Discard na po.
Observe for return of fecal material and solution and assess drainage. This indicates effectiveness of irrigation. Remove bottom of sleeve from drainage receptacle and flush toilet or empty and clean bedpan. This restores room cleanliness. Dry bottom of sleeve and clamp to prevent soiling and collects further drainage. Remove irrigation sleeve. This concludes irrigation procedure.
So, ayun, na-discard ko na po yung irrigation, yung solution na pinilagay ng solution kanina. So, ngayon po ay i-observe ko na lang po yung mga lalabas po na fluid dyan sa inyong stoma. Okay? So, mukhang okay na po. Lumabas na po lahat. Kunin ko na po itong inyong irrigation bag. Tatanggalin ko na po. Try lang po natin ng konti. Tapos,
Restore or discard all equipment appropriately. This reduces transfer of microorganisms among clients and prepares equipment for future use. Remove all discard gloves, perform hand hygiene, and don a fresh pair of gloves. This reduces microorganism transfer. Wash, rinse, and dry stoma area. This cleanses peristomal area. Apply new ostomy pouch. Spray room deodorizer if needed. This restores ostomy pouch and eliminates unpleasant odor. Lastly, remove and discard gloves and perform hand hygiene. This is to reduce microorganism transfer.
ayan, yun po na. Tapos na po tayo sa pag-irrigate ng inyong stoma, ng inyong colostomy, at nailabas na rin naman po yung mga lagay kong solution kanina, ay papalitan na po natin yung inyong pouch. So, bago po gawin yun, ay papalitan po ako ng gloves at i-discard ko po yung mga equipment na nagamit ko. Okay? ko. So, papalitan ko na po yung inyong sumi pouch. Ito na po yung papalit ko. So, ayan, tapos na po tayo sa procedure. Kung meron man po kayong kailangan, ay maaari nyo po akong tawagin, at o kaya maaari nyo po akong hanapin or i-relay po yung inyong hinaing sa mga nurse po para po ako po ay pumunta sa inyo. So, yun lang po, maraming salamat po. Ako po ay magliligpit na.
After all the procedure has been performed, make sure to document your findings.
Okay, the last thing that we need to do, of course, is to document the procedure that has been performed to the patient. Also, it is important to note the secretion, the color of secretion, how thick is it, and we need to note the reaction of the patient to the procedure that has been performed. We do this in order for the documents to serve as a communication within the healthcare professional, and of course to instill the credibility of the institution. So that is all for the irrigation of colostomy. I hope you learned something from my return demonstration. And again, I am Ruevick Charles Rio of third year student of the Pamantasan ng Luzon, Maynila. Good day.